Living with anxiety is challenging to say the least. Learning to navigate through society while coping with debilitating anxiety is quite difficult, but not impossible. Welcome to Anxiety Hut. Today's video will be a guide on how to cope with anxiety. Anxiety is draining. Living with an anxiety disorder is an exhausting task that must be attended to throughout the day, on most days. The amount of work that goes into dealing with anxiety, even the most mild of cases, is often overlooked, even by those who have anxiety disorders. It takes a lot of work to manage an anxiety disorder, even at the most basic level. A ridiculous amount of thought is put into the most basic actions, such as deciding what to have for breakfast or getting ready for work. This, of course, only becomes more difficult as the difficulty of specific tasks increases. There's a continuous reasoning with oneself, a constant debating in the mind. Some people who have anxiety describe it as having another person living in their head, constantly criticizing them. Dealing with this while performing daily tasks can make it difficult to participate in society. Today, there are skills that can be learned that help reduce and manage anxiety. Coping with anxiety involves a lot of learning, application, experimenting, and organization. It is a full-time job that has to be flexible enough to allow you to perform your normal daily tasks while still keeping your anxiety at bay. Your life has to be organized so that your coping strategy can be effective. In a way, you will have to organize your life around your routines and rituals for warding off anxiety. If your anxiety is a normal part of your daily life, it becomes necessary to find strategies, rituals, and routines to help you cope with the condition. Psychotherapy, otherwise known as talk therapy, is an almost essential part of coping with anxiety. It has been used to help people overcome and deal with their anxiety disorders. For psychotherapy to work, it must be tailored to the specific needs of the person who's experiencing the anxiety disorder. The details gained from these sessions are then used to discover the appropriate treatment methods to apply to their case. Cognitive behavioral therapy is the most common type of therapy used in the treatment of anxiety disorders. It is used to teach people new ways of thinking about and reacting to their triggers. CBT has been studied extensively and has become the standard for psychotherapy. There is also exposure therapy, which is often used to treat anxiety disorders. This involves the gradual and well-planned exposure of people with anxiety to their triggers until they can interact with the object or within the situation without experiencing any anxiety. This takes time and commitment, but it has proven to be reliable and effective. It also has longer-term results. The goal of exposure therapy is to help people with anxiety confront their fears directly and overcome them permanently. Traditionally, medication has been one of the most common ways people treat anxiety. Medication, of course, doesn't cure anxiety. It can be used to treat its symptoms, but this treatment is only effective during the duration of the time when the person is taking the medication. Once they are off the meds, there is no guarantee that the anxiety attacks will discontinue. The most common classes of medications used to combat anxiety disorders are antidepressants, anti-anxiety medications, such as benzodiazepines, and beta blockers. There are various medications that people take to help them deal with anxiety. People use antidepressants, sedatives, long-term anti-anxieties, and herbal treatments for anxiety. Some people find anxiety medication uncomfortable to use. They experience side effects such as dizziness, dry mouth, drowsiness, headaches, and more. Antidepressants are commonly used to treat anxiety, though they are made to treat depression. Using antidepressants can lead to improved mood and effective management of specific chemicals that are relevant to stress and mood by your brain. A major problem with the use of antidepressants in the treatment of anxiety disorders is that you often have to go through a host of antidepressants before finding the right fit. This is because it takes several days to a few weeks for you to start experiencing the positive benefits of the antidepressants. Finding the right fit for you can take a long time. This is why antidepressants are often administered alongside talk therapy and other interventions. People sometimes use beta blockers, which are typically used to treat high blood pressure, to relieve the physical symptoms of anxiety, such as heart palpitations, trembling, blushing, and shaking. These are fantastic for short-term use, but they do nothing to treat the anxiety itself. They just make the physical symptoms more bearable. Stress management techniques like mindfulness, exercise, and meditation can help reduce the effects of anxiety symptoms and can heighten the benefits of psychotherapy. Speaking to yourself and challenging negative thoughts in your head can give you the reins over a situation. Aromatherapy is a simple way to reduce anxiety, at least within your living space. Pleasant scents such as chamomile, lavender, and sandalwood are incredibly soothing and help activate specific receptors in your brain, which can help in reducing anxiety. Another useful tip is to identify triggers and get rid of them or remove them from your immediate environment or from view. Getting rid of your triggers is a great way to treat the effects of an anxiety attack. In cases where the trigger cannot be gotten rid of, leaving your immediate environment and going to a place you find comforting is a helpful action. You can also contact someone you trust and find comfort in and let them talk you through the experience until the duration of the attack ends. You can try meditation or another relaxation technique. You can choose to sleep. Many find that their mood is improved significantly after getting enough rest during sleep. You can also benefit from an exercise session, whether that means weightlifting, cycling, swimming, or yoga. Another important part of coping with anxiety is knowing what to do in the event of a panic attack. In especially bad cases of anxiety, the condition can lead to a panic attack. Knowing how to deal with a panic attack beforehand attacks can be uncontrollable and disabling. It is such a frightening ordeal that people who experience it often believe they are going to die. Anxiety attacks are often the result of stressful situations, and our biological response to stress is often to fight or flight. This state of fight or flight is not beneficial in the presence of a non-existent fear. A continued state of fight or flight is debilitating for anyone. It can eventually spill over and become a sort of helplessness. People who suffer from anxiety experience physical and psychological symptoms that can occur simultaneously. Some physical symptoms that may be experienced include rapid heart rate, dizziness, upset stomach, shortness of breath, chest pain, restlessness, insomnia, or diarrhea. As for psychological symptoms, people with anxiety often experience overwhelming panic, irritability, irrational fear and worrying, spiraling thoughts, and difficulty concentrating. In the event of an anxiety attack, the first step is to identify that an anxiety attack is taking place. This is not an easy thing to do, but with consistent cognitive behavioral therapy, it is possible to detect an anxiety attack before it occurs. Once you've confirmed that you're having an anxiety attack, your next step would be to remain calm. The person experiencing the anxiety attack should immediately start taking steps that will help them calm down and reduce the intensity of the attack. A great way to do this would be to use a breathing technique. Deep breathing is an effective way to stop hyperventilation and calm nerves during an anxiety attack. It can also help to slow your heart rate. Speak to yourself, whether out loud or internally. Remind yourself that the attack is temporary. This will reduce a lot of the anxiety that is built up to trigger the attack. That brings us to the end of today's video. If you found this video helpful, you can help us by hitting the like button and subscribing to our channel. You can also help us by hitting the bell button so you'll be among the first to know when we drop a new video. Have a great day.